7 important nighttime signs of diabetes you should be aware of. Did you know that diabetes isn't just a daytime concern, but can also be a sneaky nighttime visitor? As the sun sets, your body may be sending out important signals that, if ignored, could lead to serious consequences. In this video, we'll explore 7 dangerous signs of diabetes at night that you absolutely need to know. Join me as we learn how to protect your sleep, health, and even your life. You'll be surprised by sign number 1, but first, let's start with sign number 7. 1. Nocturia, frequent nighttime urination. High blood sugar. When blood sugar levels exceed normal limits, your body tries to eliminate the excess sugar through urine. This puts extra strain on your kidneys, leading to frequent urination, even at night. Fluid imbalance. Excessive urination can cause dehydration, creating a cycle of thirst and continued urination. Impact of diabetes. This is a common sign of poor blood sugar control, especially for people with type 1 and type 2 diabetes. Poor sleep quality, characterized by frequent awakenings during the night, can disrupt your sleep cycle, leading to daytime fatigue, reduced concentration, and decreased work performance. If left unmanaged, persistently high blood sugar levels can contribute to complications such as kidney damage, diabetic nephropathy, or urinary tract infections. 2. Nighttime cramps. Blood sugar imbalances. When blood sugar levels are too high or too low, the body may not be able to provide enough energy or circulate blood efficiently to the muscles, leading to cramps. Unstable blood sugar levels can also affect the nervous system, causing abnormal signals to the muscles. Diabetic neuropathy. Prolonged diabetes, especially when poorly controlled, can damage peripheral nerves. This can result in muscle spasms, sharp pain, or cramps, particularly at night. Electrolyte deficiency. Frequent urination due to diabetes can cause the body to lose essential minerals like potassium, magnesium, calcium, and sodium. These minerals play a crucial role in balancing muscle function. Poor blood circulation. Diabetes can cause narrowing or blockage of blood vessels, leading to insufficient blood supply to the muscles, resulting in cramps. Sleep disturbances. Sudden and painful muscle cramps often wake you up in the middle of the night, disrupting your sleep and leading to fatigue during the day. Reduced quality of life. Frequent cramps can cause anxiety and stress, affecting your mental well-being and daily activities. Potential complications. If left untreated, this condition could be a sign of more serious complications, such as nerve damage or blood vessel problems. 3. Nighttime thirst, high blood sugar, hyperglycemia. When your blood sugar levels rise, your body tries to eliminate the excess sugar through your urine. This process leads to dehydration, making you feel thirsty, even at night. This is a common sign in people who haven't managed their diabetes well. Dehydration related to diabetes. Frequent urination due to high blood sugar not only dehydrates your body but also causes electrolyte imbalance, sodium, potassium, making you even thirstier. Reduced kidney function. Long-term diabetes can damage your kidneys, reducing their ability to filter and retain water, leading to increased thirst at night. Dehydration due to other factors. Consuming salty foods or diuretic beverages like coffee, tea, or alcohol before bed can also contribute to thirst. Interrupted sleep. Feeling thirsty can wake you up multiple times to drink water, reducing sleep quality and causing fatigue the next day. Water and electrolyte imbalance. Drinking too much water in a short period of time, especially at night, can lower sodium levels in your blood, posing a health risk. Increased risk of complications. Frequent thirst at night can be a sign of uncontrolled blood sugar, increasing the risk of complications related to the heart, kidneys, and nerves. 4. Sleep apnea. Regarding diabetes, insulin resistance can be exacerbated by sleep apnea. Sleep apnea reduces blood oxygen levels, disrupting hormone balance and increasing insulin resistance. This makes blood sugar control more challenging, creating a dangerous cycle between the two conditions. Obesity or being overweight is a common cause of sleep apnea and a significant risk factor for type 2 diabetes. Excess fat in the neck can put pressure on the airway, causing obstruction and leading to sleep apnea. The direct cause of sleep apnea is airway obstruction. Obstructive sleep apnea, OSA, is the most common type, occurring when soft tissue in the throat collapses, blocking the airway during sleep. Central sleep apnea is less common but equally dangerous. involving a disruption in the signals from the brain to the respiratory muscles. Poor sleep quality, specifically sleep apnea, can disrupt your sleep with repeated pauses in breathing that cause you to wake up frequently throughout the night. This can lead to daytime fatigue, reduced concentration, memory problems, and irritability. Sleep apnea can also increase your risk of serious health complications. Cardiovascular disease. Sleep apnea can raise blood pressure and increase the risk of heart disease, particularly for individuals with diabetes. Poor blood sugar control. Insufficient or poor sleep quality can affect insulin sensitivity, making blood sugar levels harder to manage. Stroke. Prolonged oxygen deprivation in the blood can increase the risk of stroke. Common symptoms of sleep apnea include loud and irregular snoring, feeling suffocated or waking up suddenly during the night, morning headaches due to sleep deprivation and oxygen deficiency. 5. Nighttime hypoglycemia. Improper treatment. High insulin or oral hypoglycemic medication dosage. Using too much insulin or oral medication before bedtime can lead to a significant drop in blood sugar levels during the night. Long-acting medications. Some long-acting diabetes medications can cause sudden hypoglycemia during sleep. Eating habits. Insufficient carbohydrate intake before sleep. A bedtime snack can help maintain stable blood sugar levels throughout the night. Skipping this can cause a rapid decrease in blood sugar, especially if you are using insulin or oral hypoglycemic medications. Irregular eating patterns, uneven meal schedules, or long gaps between dinner and bedtime can also contribute to hypoglycemia. Physical activity. Vigorous exercise in the evening can increase the body's insulin sensitivity, leading to a greater decrease in blood sugar levels during the night. Biological mechanisms. Reduced glucose production from the liver. During sleep, the body relies on glucose reserves from the liver. In people with diabetes, this ability may be impaired, leading to a risk of hypoglycemia. Sleep disturbances. Low blood sugar can cause symptoms such as night sweats, tremors, strange dreams, feelings of anxiety, or sudden awakenings. This disrupts sleep, leading to fatigue and stress the following day. Serious complications. If left untreated, severe hypoglycemia can result in seizures, loss of consciousness, or even coma. Reduced quality of life. Regularly experiencing low blood sugar at night can cause anxiety, impacting mental well-being and daily life. 6. Restless leg syndrome, RLS. Peripheral neuropathy, a common complication of diabetes, is caused by prolonged high blood sugar levels. This can lead to tingling, numbness, or a crawling sensation in the legs, especially during rest or at night. An imbalance in dopamine, a neurotransmitter involved in muscle movement, can also contribute to RLS, particularly in the evening. Nutritional deficiencies, such as imbalances in electrolytes or a lack of iron, magnesium, and folate, common in people with diabetes, can increase the risk of RLS. Other factors, such as caffeine, alcohol, or smoking, can trigger and worsen RLS. Prolonged stress or fatigue can also play a role. Restless leg syndrome, RLS, can disrupt your sleep by causing uncomfortable sensations in your legs, leading to a constant urge to move. This can interrupt your sleep and leave you feeling tired the next day. The discomfort in your legs can also occur during the day, impacting your work and daily activities. Chronic sleep deprivation due to RLS can also impair your ability to control blood sugar levels, increasing your risk of diabetes complications such as heart disease, kidney disease, and nerve damage. 7. Night sweats. Nighttime hypoglycemia, or low blood sugar during sleep, can manifest as night sweats. This often occurs due to an excessively high dose of insulin or oral diabetes medication, insufficient food intake, or skipping meals before bedtime. When blood sugar levels drop significantly, the body activates the sympathetic nervous system to release hormones like adrenaline, aiming to raise blood sugar. This response frequently results in sweating. Other contributing factors include side effects from certain diabetes medications or other treatments, hormonal fluctuations, stress, and an unsuitable bedroom temperature. Night sweats and sleep disruptions can be a real nuisance. They can wake you up feeling damp and uncomfortable, making it hard to fall back asleep. This can leave you feeling tired and lacking energy the next day. In some cases, night sweats can be a sign of a more serious underlying condition, such as low blood sugar. If left untreated, this can lead to complications like seizures, loss of consciousness, or even coma. While night sweats can be a source of worry, it's important to remember that they can often be managed with proper treatment. If you're experiencing frequent night sweats, it's best to consult with a doctor to rule out any underlying medical conditions. These signs are not just minor warnings, but key indicators of your overall health. Early detection and appropriate action can help you better manage diabetes and improve your quality of life. If you found this video helpful, please subscribe to stay updated on important health information. And if you know someone who could benefit from this information, please share it with them. Thank you for watching, and have a good night's sleep and stay healthy. See you in the next video.